Okay. Yeah. Your chest, okay? So big deep breath.
And what we're experiencing now as Division 2s is
An enrolled nurse is a nurse who provides direct patient care to all patients in any given area in the hospital. They traditionally have had limited aspects of providing that care, as opposed to a registered nurse who provides a full range of responsibilities caring for all aspects of a patient's care whilst on a ward or in the hospital.
Division 2 nurse is a second level nurse. They work under the supervision of a Division 1 nurse, which is what I am as a nurse educator. Division 2 nurse is regulated by the Victorian Nurses Board, and being a second level nurse, they are responsible for, I guess, a lot of the bedside management care, assessment, and basically nutritional hydration support of the patient, resident, elder. But they do a lot more than that. They're also involved in a lot more clinical skills, aseptic dressing techniques, suture removal, drain tube removal. And at times, sometimes when we're actually working out in the field, we are surprised at how little the Division 1s know that they can actually do.
We have seen a number of changes in enrolled nurses in a number of states in recent years. In this state here in South Australia, enrolled nurses are now prepared at diploma level. And that's basically in line with the changes in the work and in the way care is delivered in our various health settings. I think enrolled nurses have a very valuable role to play within the health team, and that you know, they can work very well with registered nurses. The level of education that they're now receiving means that their role can be somewhat broader than perhaps it's traditionally been in the past. Although I think, like a lot of things, it's waxed and waned, that enrolled nurses many years ago did a lot more than they did for a little while, and now it's growing again.
I think what we're seeing is a cyclical involvement involving enrolled nurses. Traditionally, they were used as a significant component of our workforce, and then with the advent and introduction of tertiary-based education for registered nurses moving towards hospitals, we really saw a bit of an erosion of enrolled nurses in terms of employment opportunities.
It was the old SEN school of training that basically became extinct. And I think for a while there seemed to be no future for Division 2 nurses. It was realised what a huge mistake that was, because there was a dearth of healthcare workers out there with the qualifications required.
Danger, response, airway.
The role of Division 2 nurses in Victoria has recently undergone some really exciting change. The role languished for a while, particularly in aged care facilities, but there was a reduction in numbers of Division 2s. A lot of hospitals chose not to use Division 2s in their workforce profile, and with their inability to give out medications in aged care facilities, a lot of facilities started using personal care attendants. So Division 2 nurses have had a pretty tough time in Victoria establishing their role. But the board has recently, in conjunction with key stakeholders, published 2 documents relating to an extension in their practice and really putting some definition around that, but also putting out guidelines for Division 2s to be able to administer medication. So the last one in particular means that Division 2 nurses can now undertake a course which is accredited by the Nurses Board of Victoria and will allow us to endorse them on our register to give medication. That's a very significant increase in the scope of Division 2 nurses.
Definitely. Enrolled nurses have always been a valuable member of our workforce, our nursing workforce, and have accumulated traditionally a wealth of experience. Unfortunately, in the past, they haven't been recognised for that well enough. But what we're seeing in more recent times is a move towards expanding the role of the enrolled nurse and ensuring that they have a greater scope of ability and duties and care that they provide in caring for patients.
We need to support our enrolled nurses, and you'll see some of the initiatives that are being developed are related to making sure that they can go to their full scope of practice which is with their medication management. So Queensland certainly took that on very early in the piece and put enrolled nurses through medication. Talking to the leaders and our directors of nursing within those environments in Queensland, they will say that it's extremely satisfying for our enrolled nurses working within those environments. There is no doubt that we have to always monitor quality and safety and always look at how we can support and enhance that registered nurse role.